Hi there, I'm Bonnie Adam from Pathways Healing, and I'm going to demonstrate a Reiki session for you today. Before you do a Reiki session, you want to make sure that you've explained a little bit about Reiki to the person you're going to be working on so they understand what to expect and you make them comfortable. Especially explain to them that if they're uncomfortable in any way that they can tell you to stop. So once I've got the person comfortable on my massage table, I'm going to just take a moment to prepare myself. So I just do a little setting of intention to clear my thoughts in my mind and prepare to give the Reiki. And then once I've done that, I just gently place my hands on their ankles. And I like to start with the ankles because it's a little less invasive than starting right away on a person's head. And starting with the feet and ending with the feet is very grounding for both me and for the person I'm working with. And I'm going to go through these positions very quickly, but usually you would spend somewhere between 2 and 5 minutes on each of these positions, moving basically when your intuition guides you to, or when your hands sort of are not feeling warm anymore, or the tingling in your hand stops, or there'll be some kind of signal that you will have that it's time to move on. So I just hold the ankles very gently, and then I'm going to move to the top of her head. And I like to sit here because it gives me a nice angle to work on her head. And again, I come in nice and gentle and just hover. You can touch, but I find it a little nicer to hover over the head. And then the next position I would do is usually around the ears and the jaw. And I'd be here for my 2 to 5 minutes. Then I would come up over the third eye, the forehead, the sinuses, the eyes. And I'd hover here for a while. There is an option to work on the back of the head. Sometimes a little bit awkward because you kind of have to get underneath, and if the person has long hair, you don't want to pull their hair, but there's an option to hold the back of the head as well. And then usually, gently move out of that, I would go to their shoulders if I can reach from this position comfortably. And I'd stay here for a while. You can use this area to work on the throat as well. And again with the throat, I tend to stay off the throat a little bit because it can be a little bit threatening to have someone's hands over your throat. And even the heart from here you could do if you choose to. Depends on how well you can reach. And then after I've done the head and the shoulders, I usually come and slide one hand under the back of the shoulder blade. Everybody has tension here from driving and working on computers and all that kind of thing, so I like to keep my one hand here through the whole time that I'm working on a person's arm. So now I'll just keep that one hand there, and then I'll spend a little time on the shoulder, a little time on the elbow joint, and then again a little time on the wrist. And you could even add an option of bringing both hands down and both hands down onto the hand and the wrist as well. So you'll find your own way to do that, whatever feels right, whatever you can reach depending on what kind of a setup you have. And then I would start, we've done head and shoulders, I would go around and do the other arm as well, but we'll skip that for today. Then I would hover over the heart chakra. And then you can choose to hover over each chakra like this, and then you would go down that way, or you can be a little more hands-on and put your hands on their rib cage, and basically you're going to work down this person's body with as many positions as it takes to cover their body. Some people are taller, some people are shorter, so however it works to cover their body. And once you get sort of around the waistband area, I will go out to the hips, so just staying away from the pelvic area for privacy purposes, of course. You can hover over the pelvic as well, so however it works for you. And also, some people don't want to be touched, so if you had someone who didn't want to be touched, that's how you would work on them. And then usually I just come right down to the knees and hold one knee at a time, or both knees or one knee at a time. So you would, if you're going to do one at a time, you just slide your hand under, same way you did with the shoulder, or both knees. And then I go back and finish with the ankles again. And I might hold the ankles a couple different ways. So I could hold like this on the top, or I can slide under and hold the ankles from underneath. I can hold the feet a bit more, or do the feet one at a time. However it works for you in the environment and with the person you're working with. And of course, if she had a sore ankle, maybe I would spend more time on that ankle. So things like that will guide your session. So that is basically how to give a Reiki session. And when you're done, you're going to just back away nicely and do something to just kind of separate your energy from the person you've worked on. So you brush yourself off or say a little goodbye and go back to your day. Thank you very much for watching.